Now, Joe, you and I have talked about what we call minimally invasive quadriceps sparing.
Right.
What is the quadriceps and what do you mean by sparing?
Right.
And where does that play a big part in knee replacement?
Well, in your knee, the big muscle on the front of your knee is called the quadriceps. That's that big, huge muscle on the front. It's attached to this thing called the patella. So it's the quadriceps muscle function is to straighten your knee out. It's a very, very big, very strong muscle. The common way to do a knee replacement involves cutting up in through the quadriceps muscle so the kneecap can be dislocated so you can actually get inside to do the surgery. There's a technique that we've been using for about probably 4 or 5 years where we come up, we come around the quadriceps, save it, and the kneecap is slid over to the side, and then all the surgical cuts are done from the side rather than the front of the knee. So that protects that big, huge quads muscle. We don't have to worry about it healing. There's no pain because of that. So those folks recover much faster. They're able to lift their legs up in the air basically the same day, and that means that they get up, walk more comfortably and more stably. So it's a better procedure, I think.
So it's quadriceps sparing. Is the quadriceps muscle the key to recovery then? If you have to cut the quadriceps muscle, it's going to take a longer time. How much time?
With a quadriceps sparing procedure, the patients are walking pretty comfortably, even the day following the surgery, and usually by about 3 to 6 weeks they're back. They're off their canes, driving their car, can be back to pretty normal day-to-day function by about 4 to 6 weeks. So,
as compared to the non-sparing, what was the recovery time there?
It can be longer. It can take 2 to 3 months to get to that same stage. When I talk to the therapists, they really notice that these quadriceps sparing patients do much better than the patients that have had their quadriceps cut.